Brenda, could you describe the clinician's role in Families Plus?
The clinicians have a very challenging role in Families Plus, but rather exciting because they are working with children with complex needs, of course, and these children have been through adverse events. They've been through trauma. The families are in stress a lot. And rather than bring the child or the family into their office in a 1-hour confined setting, they go where the child and family are. So they're working in a clinical way with the child and family in their home setting, in their school setting, in their neighborhood. They're working with them in those settings. So they have a chance to use their skills and to move in and do therapeutic conversations in the moment when things are going wrong and when things are happening. They're there. So they are very challenged sometimes, but they are really developing high levels of skills for intervening and helping families move through problems.
So they're working in lots of different settings.
They're working in lots of settings. And, there's been a concern as we grow that our office will be too small. And I thought, well, they're not in the office very much.
Yeah, right.
The design of the program is to be out where families are and to be meeting their challenges alongside of them, rather than 2 weeks later when a family can get an appointment to hearing about what happened. So they're often on the scene.
Sure. I noticed that you've formed your overall program model in parallel with the wraparound process. Can you describe why you did that?
Our model evolved very naturally, trying to serve these types of families in a way that was comfortable for them. Mm-hmm. So it just naturally came around that we should meet them where they are instead of expect them to come where we are. So we go out and we form a comfortable relationship with them. We're able to, we can go out in our jeans and t-shirt and we talk to them and we listen, and we especially listen to what they want for their children and where they're going with their family and what their problems are. And as we move along, we help them form an idea of where they're going and what they need. So that's is that very similar to wraparound?
Yeah, and I think one of the questions we have with wraparound is, what does this child and family need to have a better life? So if it's dental care, okay, let's go with dental care. If it's a job, let's help them get a job. It's sort of whatever it takes. And it sounds like that's your approach to the families.
That's how we've always settled in, is like, we're here to work alongside of you and help you. So where do you want to go for this child? We focus on the child.
Yeah.
What do you want for your child and what's in the way?
Sure.
So we do that, and then the families are so stressed often that they get discouraged and they think they can't do it. So a big part of what we do is help the parents understand you have many things to offer your child that no one else can offer, particularly your love. There's nobody else like you for your child. So we help them understand their strengths and how important they are, and to help them believe that they can raise their child to be self-sufficient and successful.
Yeah. And I just love that, because honestly, for so many parents, they've been beaten down, they've been blamed and shamed, perhaps even by professionals who look at them and say, wow, these are really multi-problem parents. But they have really wonderful things about their parenting. Plus, they're the experts on the kid. So,
and we have this strong feeling when we're in relationship with families and we know them well. We think to ourselves, if I had all these things to deal with at the same time, I don't know if I could do as well as this family is doing, because the challenges are mind-boggling.
Yeah. They must respond well to that, because I've found over the years with wraparound that families find it incredibly refreshing.
Our families really appreciate that somebody listens to them and understands they're not just a slacker. They really have too many things to do.
Sure. Oh, that's so neat. On a different tack, I've noticed that you've started to put clinicians in physicians' offices. Can you tell me why you've done that?
Well, it's a little out of line with what we've been doing for many years, but we're trying to think forward and build a model that will work, in the future. And our sense of the healthcare world of the future is physical and behavioral health care will be very integrated. So we thought if we could work on delivering care to children with complex needs in the doctor's office, that's what we need to know how to do, to start from that base. We often have started from the schools referring and us getting involved, but we would like to get into the medical world, have the doctor refer and get us involved there so that we're integrated with the physical and behavioral health, because our kids' physical health is likely to go downhill as they grow up because their parents' health is not very good. They have poor social determinants of health, so we want to be there in the healthcare world integrating it. And then as part of the package, we agreed to also provide behavioral health care to other adults and children that the physicians are working with.
And that's exciting because it's really clear that's where we're moving. We've always separated health and behavioral health. It's almost like we're two different organisms, two different people. But the reality is it's all together. I was reading an article today from the Substance Abuse and Mental Health Services Administration, really just pushing this notion of integration. And yet, integration is kind of tough to do at times. How has it been sort of meshing the health world and the behavioral health world these last few months of this effort?
We're about 6 months into this, and let me tell you, it's two different cultures and it's two different worlds, and we can see it's going to take a lot of time. Even though everyone is very into it and enthusiastic, we have different languages, we think differently, and we don't understand each other very well. And the whole idea of paying attention to the social determinants of future health is kind of new to a lot of us, but that's what we think the Complex Kids model is doing, is trying to eliminate all the determinants that are going to make these children unhealthy as adults. And so there's a lot of conversations that must happen before we're on a team together, but before we're really on the same view together. Lot of work here.
What do the MDs think of this?
I don't think this is true everywhere, but here in Delta County, our medical providers want behavioral professionals alongside of them. They really appreciate it. They really want someone to handle a patient in crisis. They really want someone to move forward with depression treatment. They really want it, but our worlds are so different that we have a ways to go for it to be smooth.
Sure. Well, you're to be given a lot of credit for trying this out. One of the things we know about rural America, you and I both live in this little tiny county here in western Colorado, is that often the stigma of going to see a psychologist or going to see a therapist is pretty high. Do you think this helps cut that stigma?
I think it helps immensely to cut the stigma, because the stigma isn't going to evaporate anytime soon, but people tend to trust their physician. And when the physician says, you are really having a hard time with your mood, and I have someone right here that can help you today, it works. People go into the behavioral health office, they get some support, they engage, and it goes forward. Whereas in the old days, they would say, here's a phone number, call them. They might call you back in a few days, and they don't call half the time. They just don't.
It just seems so much more friendly. It just seems like a much better way to do this. Because families are, they're often embarrassed. They feel bad over what's going on. Say the family's going through a divorce and the kid's not sleeping at night. This kind of opens up an easy path into getting help for some of those things. I love it. Yeah, and
a lot of people are really moving right smoothly into it, and they feel supported by both their behavioral professional and their physician, and that all are understanding the whole dimension of what they're facing.
Yeah. Well, speaking of integration, one of the things that we talk about, integration is clearly where human services, behavioral health, juvenile justice, child welfare, housing, drug and alcohol services, corrections, we know our families have needs that cut across lots of those areas. And yet, traditionally, in big cities and little cities and all over America, these systems don't work together very well. They don't play well together. How do you get this aspect of this dealt with? I mean, how do you get the system to come together and work together around this one family? Because I know Rural people don't have a lot of tolerance for silliness, and having multiple plans for one family is kind of silly. How do you do that? How do you bring that system together?
We approach it just like we approach working with their families on a very much relationship basis. Because we're a fairly small area, our therapists form relationships with caseworkers and with teachers and educators and juvenile justice, probation officers. We have relationships that have been going on for a number of years, so that's how we bridge it.
Sure.
There are still the different viewpoints and the different rules and the cookie cutter things everybody has to do, but because we know the people and they know us, we often can pull it together and help the family advocate for themselves about, yes, this will help me, but that won't. So we often can get some distance in that way. There's definitely, of course, a lot of silos and a lot of barriers to working together, but we think we can bridge it in a small community through relationship.
Yeah, and I've always found that in a smaller community, in a more rural area, that when things work, people also talk to each other about it working. Hey, this kid was, on my probation caseload, and problems were really tough, and he was blowing it to school, but wraparound helped bring this everybody together around getting better outcomes for this kid.
We've had cases like that where juvenile justice has been reluctant to send kids home, and we're saying, no, they can do it. And then they go home and do beautifully, and everyone is very happy together because it worked.
Sure.
Their program worked, and our program worked after it.